Up to 14 new neonatal intensive care unit beds will be added to the Alberta Children's Hospital to help meet the growing need for these services in Calgary and southern Alberta.
We've long known there's a need to have a level 3 neonatal intensive care nursery here in the hospital to be able to provide care for those newborn children who have the highest care needs and the most likelihood of needs for multiple services.
The additional beds, scheduled to open next year, will increase Level 3 NICU capacity by 56% in Calgary. Level 3 NICUs are acute care spaces designed to care for the sickest and most critically ill newborns. This will reduce the need for travel between hospitals for babies with complex medical conditions or who require surgery.
To this point, children in the Level 3 nursery at the Foothills Hospital, not so far away, have had to be transferred over here on occasion for surgical procedures and then transferred back to the Foothills. That's a tough situation, especially for very little babies. The other issue is our overall need for an increased number of neonatal intensive care beds across the city, given our birth rate and the number of kids who require NICU care.
Local philanthropists Heather and Anne Murray Edwards generously donated $5 million through the Alberta Children's Hospital Foundation to help enhance NICU services in Calgary.
Well, our son was born 5 years ago, 8 weeks early, at 3.5 pounds. And so he was in the NICU at Foothills in Rockyview. And they did an amazing job of caring for him. He's now a thriving 5-year-old, and we wanted to find a way to give back. And it turned out that they were looking for someone to do, looking for a way to do an NICU at the Children's Hospital, which is exactly what we were looking for. So it just, all the stars collided, and we're very privileged and honored to be part of this beautiful facility that I know will change lives.
So the architectural firm Stantec will be the group that will be working with us at the hospital and AHS and the Government of Alberta to develop the plans for the Level 3 NICU. We want this to be able to be a family-centered kind of unit so that there's space for not just the baby but for parents to be able to be there and to be involved with the care of their child and to be able to be there on a 24/7 basis.